My name is Jeff Reiland, the host of the Parenting Tips podcast for parents of young and school-aged children. In this next series of 5 episodes, we will be discussing some important information about the big picture of raising children and why it is so important for parents to have all the tools they need to be the best parents possible. We have long known that the environment that children are raised in has a big impact on how kids turn out, and we are beginning to understand how big of an impact that is. We will be discussing adverse childhood experiences, or ACEs, the social determinants of health, protective factors, resilience, and parenting with a history of trauma over the next 5 episodes. In episode 64, this episode, we will discuss the research and implications of the Adverse Childhood Experiences study and why this has been an exciting and important contribution to our understanding of the essential role that parents play in raising thriving children. The next episode, episode 65, takes a broader view of the environment, zooming up to the 60,000-foot view, looking at research related to what are called the social determinants of health. The social determinants of health, often shortened to SDOH, has been a big part of the conversation in healthcare and policy for the last couple of decades. It may help guide parents to understand the value of this information and how it can guide them as parents. In episode 66, we will look at the protective factors that the research shows can help buffer children from the harmful effects of the challenges they sometimes face early in life. This is where parents could really shine. In that episode, parents will discover what they may already be doing that is helping and learn more about what else they could consider doing. In episode 67, we explore the concept of resilience. There are many strategies that parents can use every day to help children to be more resilient. Finally, in episode 68, we discuss what you can do if you recognize that maybe your own early life experiences weren't the best. We will talk about how to parent if you have also experienced trauma. Maybe you want to create a different kind of experience for your own family, for your relationship with your child or children. In this next several episodes, we're going to be talking about some painful information. Please take care of yourself. If you need to, press the pause button. Take some deep breaths. Keep your goals in mind. Why are you listening to this podcast series? At the very start, in episode 2, I laid out a goal for parents with a question. How do you want to be remembered by your children when they grow up and are now parents? And your future grandchildren ask them, what was it like growing up with grandma or grandpa? How do you want your children to answer that question? I wish that I could tell you that we have always known about the adverse childhood experiences. We haven't. My own graduate training occurred over a decade before the original study was conducted. For certain, we as a profession who work with children understood that children growing up in highly stressful environments were more likely to have problems. My own 2 graduate research and theses papers explored the relationship between family dysfunction, witnessing violence, addictions, divorce, and abuse, and subsequent behavioral problems in children, but it was not nearly as broad or conclusive. When the Adverse Childhood Experiences study, or ACEs for short, first came out, it felt like there was a collective gasp from the professional community that I knew. On the one hand, it all made sense. For years, we had been seeing this relationship between children with behavioral and emotional problems and the existence of some level of dysfunction going on at home. On the other hand, the data was so striking and so compelling that it was almost frightening at many levels. How in the world would people ever be able to hear about this? How would parents respond when learning about ACEs? What steps could be taken to make things better? Thankfully, we as a medical and mental health community have some answers for making things better. I'm inspired by all the parents I have had the ACEs conversation with. The most common response I've heard from parents is gratitude, like a light bulb was turned on and everything was now clearer to them about their own experiences. There is this energy and motivation about doing things differently for the next generation. At the time, the Adverse Childhood Experiences study was the largest study of its kind that established a link between childhood experiences and health and well-being outcomes across their lifespan. In a nutshell, The study showed that the more adversity or bad things that happened to someone in their childhood, the more likely they were to have health problems during their lifetime. This is powerful information, and it can feel overwhelming, but it also offers a pathway for solutions and hope. The Adverse Childhood Experiences study was conducted in the early to mid-1990s in California. Kaiser Permanente healthcare physician Dr. Vince Felitti and the Center for Disease Control researcher Dr. Rob Anda designed a study that asked over 17,000 adults in their 50s and 60s about their childhood experiences. The demographics of the participants in the study are worth noting. They were mostly Caucasian, about 70%, with about 10% each being Black, Hispanic, or Asian. About half of the study participants were men, the other half were women. Most of the study participants had some level of college education. When you think about it, they have a lot of similarity to many of the communities in the upper Midwest. In other words, the members who participated in that study look, from a demographic standpoint, a lot like you and me, like our communities. The study asked participants if they had experienced any of 10 things that were identified as adverse experiences in their childhood. They asked about abuse and neglect. Did they experience emotional abuse? A parent, step-parent, or adult living in your home swore at you, insulted you, put you down, or acted in a way that made you feel afraid that you might be physically hurt. Or physical abuse. A parent, step-parent, or adult living in your home pushed, grabbed, slapped, threw something at you, or hit you so hard that it made marks or you were injured. Or sexual abuse. An adult, relative, family friend, or stranger who was at least 5 years older than you ever touched or fondled your body in a sexual way, made you touch his or her body in a sexual way, or attempted to have any type of sexual intercourse with you. Emotional neglect. Someone in your family never or rarely helped you feel important or special. You never or rarely felt loved. People in your family never or rarely looked at each other and felt close to each other, or your family was never or rarely a source of strength and support. And physical neglect. There was never or rarely someone to take care of you, protect you, or take you to the doctor if you needed it. You didn't have enough to eat. Your parents were too drunk or too high to take care of you, or you had to wear dirty clothes. And there were 5 household challenges. Mother treated violently. Your mother or stepmother was pushed, grabbed, slapped, or had something thrown at her, kicked, bitten, hit with a fist, or hit with something hard, repeatedly hit for over at least a few minutes, or ever threatened or hurt by a knife or gun by your father or stepfather or mother's boyfriend. Substance abuse in the household. A household member was a problem drinker or an alcoholic, or a household member that used street drugs. Mental illness in the household. A household member was depressed or mentally ill, or a household member had attempted suicide. Parental separation or divorce. Your parents were ever separated or divorced. And finally, an incarcerated household member. A household member had gone to prison or jail. The results of the ACEs study were astounding. First, ACEs are incredibly common. About 2/3 of people have experienced at least one adverse childhood experience. About 12%, or 1 in 8 people, have experienced 4 or more adverse childhood experiences. As the number of adverse experiences increases, so also does the risk for a large number of health issues. Adverse childhood experiences are linked to injuries that include traumatic brain injury, fractures, and burns. They're linked to mental health problems like depression, anxiety, suicide, and PTSD. They are linked to maternal health problems like unintended pregnancy and pregnancy complications and fetal death. They are linked to infectious diseases like HIV and STDs or STIs, chronic diseases like cancer and diabetes. They're linked to risky behaviors that include alcohol and drug abuse and unsafe sex. And finally, they're linked to lost opportunities in education, occupations, and lost income. The original 10 adverse childhood experiences are only the tip of the iceberg. Many scholars and scientists have identified quite a few additional experiences that could also contribute to poor health outcomes that were not included in the original research. These subsequent studies have expanded this list to include community stressors and other trauma like living in poverty, homelessness, living in unsafe neighborhoods, exposure to gun violence, experiencing discrimination, being bullied at home or at school, and many others. I suspect that more conditions will be added to the list in the coming years as research continues. So, how does this happen? To make sense of it all, researchers designed a model referred to as the ACE pyramid to help explain how a child may go from early life adversity to having health and social problems and experience an early death. How is this even possible? A link to the website, the Community Resilience Cookbook, explains this in far greater detail than I can in this podcast episode, so please be sure to check this out in the podcast show notes. At the base of the pyramid are adverse childhood experiences. Whatever their number or severity, they pose the risk of creating stress on a child's developing brain. Now let's pause and talk a little bit about stress. There's a lot of stress going on in our lives. First is something we call positive stress. Positive stress is fairly short-lived. Examples include attending a new daycare, getting a shot, studying for a test, having a timeout, or missing a friend. Those are typical things that kids experience, and they're not devastating, but they are stressful. The next level of stress is called tolerable stress. It is more intense, but it's relatively short-lived, and that can include things like a natural disaster, a death of a loved one, a peaceful parental separation or divorce, or a move to a new home, or a change in schools, or a parental loss or change in jobs. And finally, there's overwhelming toxic stress. And those are the experiences we're talking about. Intense adverse experiences that are sustained over weeks, months, or even years that include things like abuse, neglect, addictions, parental mental illness, conflictual divorces, witnessing violence, and poverty. The consequences of toxic stress in children's lives are well understood. And it's all about the brain. Brain development is activity dependent. Children's brains are very malleable and receptive to experiences, and they can adapt to all kinds of situations. But exposure to trauma, neglect, and violence in any form early in their lives can alter normal brain development. And the negative experiences they have will create a brain that's poorly suited for operating in a healthy environment. But positive early life experiences can lead to positive normal brain development. When children are exposed to too much stress and they don't have the kinds of supports and skills to manage this stress, it has a negative effect on their brain development. And that can lead to difficulties with learning, thinking, and social and emotional development. When kids struggle with challenges like this, it can lead to adoption of health risk behaviors that include poor choices. But it's not limited to just kids making poor choices. Even when kids make good choices, they still have higher risks for health problems later if they were exposed to a lot of adversity earlier in life. The adoption of health risk behaviors includes early use of substances like alcohol, tobacco, and nicotine products, cannabis or other illegal drugs, engaging in early sexual behaviors, developing an addictive relationship with technology, or getting into trouble in other ways that can have costs when it comes to a child's social and emotional development. This can lead over time to disease, disability, and impaired social connections or meaningful relationships with others. For some, it can lead to an early death. In the original study, individuals who identified having 6 or more of the 10 adverse experiences in childhood were more likely to die as much as 2 decades or 20 years earlier than those who did not. So when kids experience too much stress for too long, it can literally disrupt how the child's brain develops. This is why so much of great parenting is not just discipline. It is about having a positive relationship with a child. It's about helping them to develop the ability to regulate their emotions and thoughts and behaviors. Much of the Parenting Tips podcast is dedicated to these very things. If this is the first time you're hearing about the adverse childhood experiences, you may be wondering if it's true. And it would be easy to just say that one study done in California 30 years ago is just an outlier. Except that study has been refined and replicated many times in most states in the United States and elsewhere with the same results. It is important to point out that the ACEs study looks at correlations and not causation. This is the scientist, researcher, teacher in me. When two things are highly correlated, it means they both seem to be occurring in the same direction. That is the dose-response relationship. The higher the number of ACEs, the more likely a person is to have health and social problems across their lifetime. While it is very likely that there is a causal connection between high ACEs and poor health outcomes, there are other important factors to consider, including genetics. So an important message is that two things happening in the same direction does not necessarily mean that one caused the other. There are many other things, including protective factors and resilience, that we'll be talking about in episodes 66 and 67 that can buffer or protect children from some of the harmful effects of adverse experiences that we've been talking about. I want to encourage you to exercise caution about using ACEs as if it were a score. It may be tempting to keep score of your own number of ACEs. I think it is human nature to wonder if some of what is described in this study is also too familiar. Keep in mind that the original study included only 10 possible adverse experiences. Many subsequent studies have expanded that number. There are likely 20 or 30 adverse things that children can experience. Why not an ACE score? The reason I discourage folks from focusing on the ACE score is that it is only one measure. It provides an incomplete picture. Let me give you an example. If I asked you how big your living room was and you told me it was 12 feet wide, that would be helpful, but not complete. I would not know how long it was or how tall the walls were to the ceiling. The ACE score is only one dimension. Or if you went to the doctor and they only took your temperature but did not measure your blood pressure or your blood sugar level, it would only give you one piece of important information. For this reason, the ACEs data should be considered for its statistical importance at a population level and not an individual level. It is not a done deal. High ACE scores don't immediately translate to all the bad things that I've mentioned. You may have people in your own life that you know who fit the profile exactly. And you may have people in your life who had horrible early life experiences and they lived joyful lives well into their 90s. I know this is true because I've also experienced amazing people in my life in both directions. Clearly, there is more going on. What is missing is some way to also measure the protective factors and the kind of resilience that may also be present for children and their families. So what can you do? The solution is simple and hard. According to the Centers for Disease Control, the best way to prevent ACEs is to create and maintain safe, stable, nurturing relationships and environments for all children. I remember the light bulb that went on in my brain back in 2011 when I was preparing to teach a course at the University of Wisconsin-La Crosse. I was listening to Dr. Vince Validi respond to that same question, what can be done about ACEs? In a spontaneous moment, he gave his opinion, which has been borne out through science. One of the best ways to reduce or prevent ACEs is to improve parenting skills and practices. Those have been my marching orders ever since, and I am grateful for the inspiration and the opportunity to provide those resources to parents to do just that. One of the clearest ways to reduce risk and to prevent ACEs is to improve parenting practices. When parents have better tools, when parents understand child development and what their child needs, they can become more effective parents. We will discuss this in more detail in the parenting podcast episodes on protective factors and resilience. I want to talk about another resource that I really would encourage you to check out. Dr. Nadine Burke, who is a former Surgeon General from the state of California, gives an excellent TED Talk about ACEs. I would encourage you to listen to her talk. How childhood trauma affects health across a lifetime. The link can be found in the show notes. Also, the Centers for Disease Control has a great web page that breaks down adverse childhood experiences. And then finally, again, the Community Resilience Cookbook explains this concept of adversity and how it affects developing brains in far greater detail than I can in this podcast. To recap, adverse childhood experiences are common. They tell only half the story. Protective factors and resilience tell the other half of the story. Parenting practices, something you as a parent can control, are one way to lower or prevent the risk of adversity in your child's life. Please keep learning about this important topic. It is real, it is raw, and there is hope. I strongly encourage you to listen through the next several episodes as we broaden the lens to look at social determinants of health, and then protective factors, resilience, and finally, how you can parent if you have experienced some form of trauma or adversity yourself, and it's getting in the way of your parenting. Thank you for tuning in and considering this parenting topic. I hope this information has added to your growing toolbox for parenting your child or children. Please consider exploring other topics in this series. Remember, no one parenting tool can do everything. We need many tools to become the best parents for our children. Your children's future depends on you and the time and effort you invest in them today.